Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have an exciting session with Dr. Hoover. Dr. Hoover, thank you so much for joining. And on that note, the floor is yours to take away.
Wonderful. Well, thank you so much for the privilege to be here tonight. What a great group. I'm so impressed by your organization and creativity to even form this group. So let's get started. So I am a general dentist, and we'll talk more about what that actually means. But I wanted to start with a little background on myself and say, what does an archaeologist, karate kid, and pediatrician have in common? And I think most people would say nothing. But in my life, it actually, all of those intertwine. I thought from a young age I would be an archaeologist. I was a strange little kid. And then I thought I would be the next karate kid. And then eventually I grew up a little bit and thought I would become a pediatrician and work with kids. I shadowed a pediatrician and realized that was not at all what I wanted. I love kids, but just not my cup of tea. And so I was talking to my mom one day, and she said, in all her wisdom, she said, "Why don't you shadow our dentist?" And I remember honestly laughing out loud and said, "Who would ever want to be a dentist?" And at this point, I am in my junior year of college, and I did go shadow my dentist that I knew very well because I had lots of cavities growing up. And in shadowing him, I realized what he was actually doing when he did all those fillings. And there's so much art and science behind it that I fell in love with dentistry at that point and shifted from pre-med to pre-dental. And as many of you know, there's a lot of crossover in those classes, so it wasn't very hard to make that shift. So I started down the course towards dental school. So I did my undergrad at Furman University. I actually got a BA in history, which is kind of unique to go to dental school with a history degree. I did, of course, have all my sciences that qualified me for dental school. I went to the Medical College of Georgia, the School of Dentistry, which is now called something else. And I had the honor of being the president of my class for 4 years, and I graduated in 2007. I was an associate in a number of practices, which we'll talk about in a little bit. And then I started my own practice in 2013. I'm a member of some of the organizations you see on the screen. And then the West Paces Family Dentistry is the practice I started in 2013. My advice for you guys is actually, how do I go back? Clear away.
Do you have a keyboard with the arrows?
Got it. Just sorry.
Okay.
Yeah.
There you go.
Okay, my advice for you guys, sorry about that, is actually a congratulations. You have truly chosen what I personally feel is the best profession out there. I tell my patients that every day, that I love dentistry more now than I did years ago. And I think it's because dentistry offers flexibility, creativity, personal interactions with your patients. You truly get to know them, leadership opportunities. It is profitable, of course. You have trust in your community. People just look up to you in a lot of ways. And then, of course, there's the balance of science and art. So it is worth every hard day to achieve this goal. And in applying, I know there's obviously the DAT prep, but it seems to be now that the big thing that schools are wanting is the hands-on experience of their students. So as much as you can get in an office, assist. I know in our office, we continually have people coming in to shadow, and it's just so much fun for me to show them dentistry in the real world. Obviously, keep your GPA high. I think that goes without saying. And I think the thing that honestly, in my experience, set me apart for dental school was the research I did. I worked at the CDC for a summer and then continued doing research in my undergrad. And I will be honest and say that was not my favorite thing to do. It certainly was interesting, but I think it did set me apart a little bit as I applied to dental school. And once you're in dental school and accomplish that goal and get out, dentistry can take you in so many directions. I mean, I look even at my dental graduating class of 59, and we have all done so many different things with dentistry. And it's our unique interests and perspectives that have taken us into the direction that we want to go. And on those really hard days, I would say in dental school or even getting through the application process, just hang in there. It is worth every hard day. It is, you're going to love it. So let's talk about, um, I'm sorry, I keep jumping ahead. What is general dentistry? So most of you probably already understand this, but just to cover it, it's the bread and butter of dentistry. So I'm the one that does the fillings, crowns, extractions, partials, dentures, and root canals on a limited basis. And we'll talk about that. I'm also the quarterback of dentistry. What that means is I determine the treatment plan for my patient and in which order to execute it. So I'm the one referring to the specialist and guiding that specialist. Of course, they are well versed and they will help guide me as well. I'm the referral source of dentistry. I'm sending patients for the treatment that I don't want to do. I do not do extractions, so that's one where it's a very easy referral for me. One aspect of dentistry that I love is that I get to treat all ages. My youngest patient is 2.5 years old. My oldest is 94 in the practice. So seeing all ages has been so fun for me. And you're also the jack of all trades if you're a general dentist. You do a little bit of everything, which really attracted me to general dentistry. I did not want to do the same thing all day. So for example, I may do a crown prep in one room and then go see a partial in the next room. And then I may go see a child and do their first cleaning. And then I may start a root canal. And so there's never a dull moment, but because of that, you do obviously have to know a variety of things, but it keeps it interesting. So what does a typical day in general dentistry look like? I think it depends on where you are. I've worked in 4 different offices as an associate, one of those being a corporate office. So I've seen a variety of office structures. And I would say how you schedule your patients speaks volumes to them. After seeing multiple ways of running a dental office, when I set up my own practice, I decided to be very intentional in my scheduling. So I see it as relationship first and dentistry second. And what I mean by that is we allow time to talk with the patient. We have multiple generations in our practice. So I know the grandmom and I know the cousin and I know the aunt. So talking and chatting for a few minutes is just paramount. So we schedule accordingly. We give ourselves a little extra time to make sure that the patient feels comfortable and is ready to come back. And honestly, part of that is the reason for our success. Our patients know we care about them and that they're not just a number. So procedures that I personally do, most of my practice is based on crowns and fillings, then Invisalign, partials, dentures, Zoom, which is in-office whitening. We also do a number of veneers, anterior root canals, bruxism guards, and implant restorations. The things that I don't do and will always refer out are extractions. I don't do implant placement or posterior root canals. So I just took a picture of a typical day in our office. I did not look for something special or anything that was flashy or showy. This is just a normal day. The column on the left is my column. I do have 2 rooms that I work out of. I primarily like to work out of one room, but we have that second room for overflow or if we happen to be running late. So the column on the left is mine. The column on the far right is our new dentist who just joined our practice. So as you can see, that's kind of what a schedule looks like when you're first starting off. She has 1 patient. And then the columns in the middle are two hygienists. And we'll go through a little more about the flow of the day. Here's just another day. Um, Again, nothing too big. There's that first patient on the left is some bonding that needed to be taken off so she could get her brackets put on for her braces. The blue down towards the bottom is the in-office whitening. And then there's some fillings and such scattered in there as well. Our practice is very unique. I can discuss more of this in the question and answer if you want, but I am in an office with two other dentists, but we are our own practice. So I am Wes Pace's Family Dentistry, and they are a separate entity all to their own, but we share this space to keep the overhead down. In doing so, it's been quite successful where I didn't have to find $2 million to build my own practice. I could slowly kind of tiptoe into it. It also presents some unique challenges as well because we do share the front desk staff and our hygienist. So we each pay a portion of their salary. The origin of this actually dates back to the gentleman on the left. And I don't know if anyone recognizes him, but that is Thomas P. Hinman. And most people in dentistry will at least recognize that name. There's the big Hinman Dental meeting in Atlanta every year. So he actually started the practice that I'm in, and he started the format bringing in dentists where they each are able to build their own practice, but yet work in conjunction with one another. It's interesting because the practice is almost 100 years old. So we have a number of, like I mentioned, generations who have been in our practice with us. And because of that, we do have some older equipment, some older styles of doing things. And then when I joined, I brought in newer equipment and newer styles of doing. So we are very much a hybrid of both. For example, I'm really big into technology. So one of the first things I did was brought in the CEREC machine. The picture on the left is the scanner and the computer in which you design the crown. The picture in the middle is the milling unit, and the picture on the right is our oven. I primarily do Katana, which is a type of zirconia, Emax, and Celtra Duo. And I'll show you a case a little bit later of the Katana in detail and how we used it on a patient. We also do a fair amount of Invisalign, and bringing that technology into our office has been wonderful. Invisalign is just achieves great results, and our patients have been very happy with that. So I've been to a number of lectures, and my favorite lectures are actually the ones where they show you what went wrong and why it went wrong. And to me, that's how we learn. So I wanted to show you some cases where things went wrong, in hopes of making that a learning process for all of us. So the patient on the left came in for the Zoom, which is the in-office whitening that I mentioned. He was not my patient. He is a patient of one of the other dentists in my practice. And we put the cheek retractor in to get him ready for the Zoom. And we noticed that that number 10, where that arrow is pointing, looked a little different. And so we thought we needed to examine that some more. He had never noticed it, never complained about it, never been an issue. So we took an x-ray, and as you can see in the picture on the right, that he has resorption in that area. Many years ago, I think it was a football injury, was hit in the mouth, and it ended up with 2 root canals. And he thought that was the end of the story until we took this x-ray. So we saw the resorption, and we said, okay, we got to take a step back. What do we do? I sent him to the endodontist. She then sent him to the periodontist, and they decided to try and treat this as best as they could. So the periodontist laid a flap and then tried to get a filling in there as best as possible. As you can see, very difficult procedure, not the best feeling, but really the best we could expect. But that only lasted for a few months. And then he had to have the tooth pulled. So we had gone from bad to worse very quickly for him. And he wondered what he would do next. So at this point, we discussed an implant. In his case, there was concern about the bone quality. And so an implant was not recommended. And so we then discussed a bridge. So a bridge, as you can see depicted in the cartoon pictures there, is when you're missing a tooth and then you prep the two adjacent teeth for crowns. And then the bridge slips on top of those adjacent teeth and you cement it in. And I will say the lab did a phenomenal job with his bridge, and you would have no idea that it was even a bridge. And we went from bad to worse to the best for him. So one more case of when things go bad. This gentleman I got to know really well. I saw a lot of him. He had seen his brother-in-law, who was a dentist, and had prepped all anterior crowns from 5 to 12. And for whatever reason, whether they were over prepped or just due to his very heavy bite, those crowns popped off left and right. I saw him on multiple weekends to try and re-cement crowns. And the picture or the x-ray on the left just shows you an example of when the crowns came off, there was not much holding them on at all. So we finally had to just say, you know, this is not working. There's just nothing to hold these crowns on to. And he agreed. And so he saw our oral surgeon and we went the implant route. So the surgeon placed 4 implants and then we did a bridge, implant supported bridge for the anterior. And thankfully, I only see him at cleanings now. He's not calling me on the weekends because the crown came off. But the picture on the bottom, we will also look at again, but it's just a depiction on how you take an impression of an implant. And this is something I do regularly. The main things you need to know are the brand name of the implant and the size of the implant. And then you need to have the impression coping that works with that size and brand name. And once you get it fully seated, you take an impression of it. And then the depiction on the right is what it looks like when you send it to the lab. So let's look at one case in depth. This was just, again, I didn't try to pick anything special. I just wanted you to see what a general dentist might do on any given day and how multiple disciplines within dentistry can come together with one patient. And I think this gentleman is a great example of it. So he, as you can see, has decay on the distal of 14. And just before I go too far into this, we flip our x-rays, which certain dental schools will teach you one way to mount the x-rays versus another. So if you get confused by this, just know we flip our x-rays. So that is number 14. And on the distal, you can see there's decay under a very old existing crown. Down below is number 19, which is missing and has an implant and is ready for restoration. So in this case, I decided, he was very nervous. He was new to me. He was referred by my colleague in the practice. So I wanted to take it easy on him the first visit. So I told him, hey, let's not drill, let's not do numbing. Let's simply take an impression for your implant, and then we'll get you back. And on that second visit, we'll do kind of the harder work. I also wanted to do this because if you look at number 14, you can see that it is drifted down. And there's not a good way to restore number 19 if the plane of occlusion is all messed up. So we wanted to get the implant crown in perfect plane of occlusion and then have 14 then adapt to that. So again, I knew the implant maker and the size, and so I was able to put that impression coping in, there's little screwdrivers. Essentially, you make sure you time that impression coping all the way down, kind of torque it into place. You take a PA or a bite wing just to see that junction of where the implant and the impression coping meet, and make sure that there's not a gap there. And if all looks well, then you use light body to inject around that impression coping. And then in your impression itself, you have a heavy body and then seat that together. After about 4 minutes, the heavy body and light body have hardened, and then you're able to just remove the impression. Then you take out that impression coping and put it in the slot in the impression itself, and it kind of pops into place. So you've seated it correctly, and then that you send to the lab, and you put the healing cap back on the patient. So that was his first visit. He was grateful for a little bit easier first visit. But to walk you through our second visit with him, in our office, again, we tried to be very personable. So our assistant goes out and greets the patient, asks them how they're doing, come on back, tries to make it upbeat. We have the patient sit down, take their blood pressure. If we haven't taken an x-ray that we might need, this is the point where we take it. And then I'll come in the room and greet the patient as well, and then get them ready by numbing them. My go-to is Septo. Septicane pretty much does everything I need it to do. And then if that's not working, or if I'm doing a block to numb the lower teeth, then I'll do lidocaine. But in this case, I only needed to numb the upper tooth for the crown. So 1 carpule of Septicane was plenty. We were going to start by scanning the upper teeth with our CEREC machine. And this is a great time to do it while the patient's getting numb. It's a time saver. It's just a great way to be productive. We did not scan the lower because, if you remember, I have not seated the implant crown yet. So at this point, I don't want to scan the lower teeth. Once he's numb, I removed the existing crown on number 14, removed all that distal decay that we knew was present, kind of re-prepped the tooth. It was old, so it needed a little bit of refinement. And then while in there, noticed that there was decay on number 15, right on the mesial. I had direct access for it, so this was the time to restore it. So I etched, bond, and placed composite in that area. It's important to do that at this step because my contact for my crown on 14 was dependent on 15's decay being removed and restored correctly. So order matters. Then at this point, I know I've got 14 prepped for the crown. I know I've got 15 restored. I can now turn my attention to number 19 on the lower to seat the implant. And if you recall, I asked the lab to make number 19 perfect in the plane of occlusion, meaning it was aligned with all the lower teeth in the correct way. So we went ahead and seated number 19 implant crown, and now we're ready to scan my prep on 14 and also the lower teeth so that we can make our new crown. And a few more pictures to explain that. This is kind of a general setup for a procedure like this. It requires a good bit of dental instruments. The picture on the lower left is my basic kind of setup that I use. The pack on the left is a Mirror Explorer, perio probe, and cotton pliers. And then I'll have a high speed and slow speed. And then the instrument with the red coloration is a crown remover. So in order to remove an existing crown, the way I do it, everyone does it different, is I section the crown in half with a burr, and then I apply pressure with that instrument, and hopefully, and typically, it'll pop off. Sometimes porcelain will pop off, but it eventually gives up. The picture above that is my assistant's tray. She's got articulating paper, forceps if we need it. We use Rely-X as our cement. And before we cement a crown on, we do an internal cleanser on the crown just to make sure there's no debris on the crown from the milling unit. And that just helps the cement hold. And then to the right of that is for our composite for that cavity that we saw in number 15. Uh, the etch is not there, but we etch. And then we use Voco, which is a type of bond. You pop it and then you mix it on the brush, and then you place it on the tooth in a dry environment, and then you like cure it, and then it's ready for the filling, which in that case we use TPH that you see in that gun there. And then down below is the implant stuff. So we already had the impression of for the implant from his previous visit. So that's the model that you see. And now we're ready with the crown and all the instruments we need to place the implant crown into place. When we're scanning, I'm not sure if everyone has seen this or not, but scanning in dentistry is just amazing. And this is actually an older version, but it is such a service to your patients that you can offer the same visit for a crown. And honestly, the crowns are beautiful, they fit well, and they're just well made. So on the left, you can see where we selected the tooth number that we were doing the crown on. And we've also selected the material. As I mentioned before, there's Katana, there's Emax, and there's Seltzer Duo, and there's hundreds of other materials. Those are typically the three I stick with. A zirconia is extremely hard. So on a back molar, it's the best choice that we have to offer. Katana is a type of zirconia. It's a prettier zirconia. It looks a little more natural. So when I can, I use Katana. And then Emax I would use on premolars. It offers a little more beauty than a zirconia crown does, but also has incredible strength. And then Seltra Duo is my go-to if there's just not much tooth structure left and I really need to bond a crown into place. So that middle picture you'll see is the proposal for the crown on number 14, and it looks wonderful. The picture on the right is a bite image that we took. And then on the left is our milling unit, and it's milling the Katana. It mills in a dry environment. It is actually very brittle when it comes out of the mill. It's also quite large, and it's white. So what you see in that middle picture is an example of what the patient sees when it comes out of the milling unit. And I often tease our patients that, I just made them a horse tooth because it's huge. But in all reality, when it goes in the oven, it gets to near 3,000 degrees temperature. In about 15 minutes, it will alter the zirconia to where it's the right shade. The zirconia itself reduces to the right size, and it also hardens to where you literally could take a hammer and not break that crown. And that really is an overview of that patient and what we've accomplished over and over again, thanks to general dentistry and thanks to technology that we have on hand in our office. And I think his case reminds me of a quote that I actually found back in dental school, and really kind of hung on to it, that Michelangelo wrote a long time ago. It says, "Every block of stone has a statue inside of it, and it is the task of the sculptor to discover it. I saw the angel in the marble and carved it until I set him free." And that is just such a great reminder to me in dentistry that we see the end result and we help the patient get there. And in that, there is a lot of sculpting and a lot of science that goes behind that. And then one last quote, a good deed here, a good deed there, a good thought there, a good comment there, all added up to my career in one way or another. And I would say I'm in my 40s, so I'm not done with dentistry. But as I look back over 14 years of dentistry, it is just one good moment after another, and I'm very grateful for this profession. And thank you for the chance to share it with you.
Thank you so much, Dr. Hoover. That was an amazing presentation. So I'm going to hand the floor over now to Ibrahim. But before I do that, I actually have a quick question that you
Sure.
mentioned in one of the cases, and it was the differences between the dental anesthesia. I was just confused. There's like lidocaine, carbocaine, septocaine. I was really confused. Like, when do you use, which dental
Which one?
anesthesia? Yeah.
Sure. So I believe in dental school, they really, you start off with lidocaine. That's kind of the most common numbing medicine. But septocaine is, I would say, a better version of that. It acts faster. You get more profound numbness. So it is a bit of a time saver. You don't have to wait on septocaine to get someone numb quite as long as you do lidocaine. The difference is you just don't use septocaine when doing a block to numb these lower molars. So that's when you would default back to lidocaine. You also, both lidocaine and septocaine have epinephrine in them. And so if you have someone with high blood pressure, um, or uncontrolled blood pressure, you're going to have to opt to use a different numbing medicine, which is called Sitness Plain, and it does not have any epinephrine in it, so it's safe for them. The problem with that one, though, is they don't stay numb very long and they don't
Mm.
get profoundly numb.
I
So
know
every,
septocaine is actually longer as well than lidocaine, from what I
yes,
understand.
yeah, I would always default to septocaine
It's more
unless
effective.
there's a medical reason not to.
Perfect. Thank you so much. That explains it
Absolutely.
well.
Well, thank you so much for that presentation. I'm sure we all learned a lot, and you're passionate about general dentistry. And so we got a couple questions here. Let's see if more people start asking them. But first question is: do you feel as though the technology for dentistry is quickly evolving?
Oh, absolutely. I think technology is such a service to our patients. It makes dentistry much less invasive, much more enjoyable, and a better end result. But is it evolving 100%? I think it's hard to keep up with it completely. I am not one to get on the cutting edge of something because I feel like often you can get yourself in trouble with that. But I am certainly one to jump on board with technology once I see that there is reputable studies to prove that it's worth it, and implement technology as much as I can into my practice.
Yeah, 100%. And I've seen like multiple dentists that I've shadowed. Like a lot of them just prefer to do like traditional like dentistry, instead of going into like the new technology. Like I never even heard of like the machine that you just talked about.
Oh, really? Okay.
Like that's
Yeah.
really interesting, and that in itself shows like the future of dentistry and what else we can accomplish. But yeah,
Yes.
Actually,
um,
on that topic, we always talk about like technology and things like that, but are there like any, I guess, like arising issues in dentistry, like something like how patients are having an issue having access to healthcare? Are there any like other issues in dentistry that are going on that we should be aware of about?
Oh, I think access to healthcare is always an issue. I knew I was before children super involved with the Academy of General Dentistry, and that was a big discussion that they always had. Was it really access to care, or was it interest in care, essentially? And it's probably a little bit of both, but the biggest issue I would see heading your way is the rise of corporate dentistry and what that does to your ability to open your own private practice one day. It does limit your options as corporate dentistry tends to just take over. And I say that as someone who worked in a corporate office for a little while. And
Yeah,
I
that's
can
that's
explain the difference more too, if that needs more explanation.
yeah. Honestly, I don't really understand that. Corporate is more owned by businesses, while private is just a general dentist by himself.
That's exactly it. So corporate, and not all corporate offices are the same, but you essentially have business people making the decisions for the dentist, and telling them, or gearing the treatment towards a bottom line in some instances, not all. And then in a private office, you have the dentist himself or herself making those decisions. So it's kind of a bigger versus small approach.
That makes sense. Thank you.
Mm-hmm.
Well, I actually have a question myself. I might have a couple more, but one of them is, obviously in dental school, you obviously have a lot more work, a lot more credits and stuff. What about like the work-life balance? Like were you able to make it happen? Can you give me input about that?
Yeah, that's a great question. So, in my experience, the first 2 years of dental school were the hardest. That's where you're doing a really heavy course load, and then they're starting to introduce patient care and labs as well. So, the first 2 years were pretty intense. Personally, at that point, I, I was just trying to keep my head above water. But after you get into that third and fourth year, things have made sense. Things tend to slow down. You're really in the clinic more. You certainly have classes, but it's just really geared to dentistry at that point. And there was a more of a balance. I also had wonderful friends in dental school. We got to do a lot of fun things. We certainly spent a lot of time studying together, but that's not all we did. So there is the ability to balance. Just know going into it, those first 2 years, at least at the dental school I went to, were pretty intense.
So is the first year usually just didactics, and then clinical and stuff take over with like the second and third year?
That's right. So that's the case for me. I think each dental school is different, and I think MCG has also even changed their curriculum. But in my case, the first year was a lot of sciences, and laying the anatomy, just kind of laying the framework for dentistry. And then the second year, we did start to see each other as patients, which was really fun. We even numbed each other. And so there's a particular day in dental school where your whole side of your face is numb because a student has numbed you and you've numbed them. So you learn on each other a little bit. And then we did cleanings on one another. And then we were allowed to start seeing general patients at that point.
That's awesome that you guys actually like work on it. I didn't know that. That's cool. But did you
Yeah,
do?
we did. It was interesting. You
But
got to learn somehow.
did you do any like research or like mission trips or community service, like of any of that kind?
Yeah, it's a great question too. So I did not. I had a lot of colleagues that did go on mission trips. I have done a lot of mission trips since then. We have my husband and I. We have a nonprofit in Nicaragua, so we
Oh,
go
wow.
there as much as we possibly can. And part of the trip is to do dentistry, but also we have found that working with a local dentist in the village is actually a better sustainable way to treat the friends in Nicaragua. Because if we come in and sort of take over, and then we leave, what have we accomplished? Something, but not a lot. So we've actually partnered with multiple dentists in the area that we go to in Nicaragua so that the people have a sustainable relationship once we leave.
Oh, that's super great.
Yeah, 100%. That's really good to hear because I know it's one thing to be rewarding in like actual office, like in your clinic, but then actually, seeing someone in Nicaragua who you've treated and
Yeah.
they improve like their health and their confidence. That's like I'm sure like extremely rewarding. It's one of the reasons why a lot of pre-dentals like want to become dentists, right?
Yes.
So
Yes. Just another thing. I mean, like I said, dentistry can take you a lot of directions, but in a few months, we've got an outreach with the homeless of Atlanta where we'll do oral cancer screenings, oral hygiene instruction, and then kind of geared on what their need might be, we'll direct them to a local clinic. So there are so many ways to volunteer in dentistry, and so many dentists that do. I feel like dentists as a whole are very uh, giving of their time and their talent.
Yeah, perfect. So we got a couple more questions in the chat. One person asked, can you share some tips on how you can approach shadowing at an office? Should I bring a resume with me while asking them for the opportunity to shadow?
That's a great question. So in my office, I like jump on a chance to have someone shadow. So if you're in Atlanta, then come on over. Um, I know in the COVID world, it might not be that easy for every office to open their doors. But I think a resume, a phone call, if you can stop by in person and meet the front desk is really where the decisions are made in an office. So if you can get to know that front desk person, then they're going to go tell the dentist likely that you're a great candidate to come shadow. But yes, I would drop something off, a resume, references. But I would first start with a phone call and make sure that they're okay with you stopping by. And then just stop by briefly. Don't take up too much time, but share your resume and references and make sure they've got a good way to contact you.
Got it. Thank you. Another person asked, is there anything you wish you knew before starting your career in dentistry that you can help with future dentists with?
Yeah. So my hardest thing, and you probably have heard this from other dentists, is the business. It's not even the numbers aspect of it. When I started my practice in 2013, I'm not a businesswoman, never wanted to be, but I was kind of thrown into that position and I learned it. But what is hard is the hiring and firing, the finding the right people to make up your dental team. There's a lot that goes into that I was not prepared for.
Definitely, I totally agree. I'm sure it's really hard, like balancing actually doing your job as a doctor versus, being a businesswoman, right? Especially if
That
you're only, yeah,
Oh yeah.
that's pretty crazy.
It's true. When I was an associate, I did not appreciate how wonderful that was. I just did dentistry and I left
Yeah.
and went home. And if something was broken or there was something that needed solved, I didn't have to do it. It wasn't my job. But as a business owner, your job is to do everything essentially, and you need to know a little bit about everything. And there are days I wish I could just do dentistry, but there's a myriad of other things that I have to take care of as well. But it also provides an opportunity to create something that is unique to you and to your practice. And I've really enjoyed that process.
Dr. Hoover, I actually had a question about one of the cases, and you brought
Sure.
up the etching material. And every time I shadow, I never really understand its purpose before the
Sure.
bonding.
Yeah, no, that's a great question. So in the tooth itself, on a microscopic level, there are tubes, little tubules in our teeth. And the etchant actually cleans out those tubules and opens them up so that that next step, which is the bonding agent, actually flows down into those open tubules, and then you harden it with a light. We call it curing, but you're just hardening that dental or that bonding agent into those tubules, and then the filling goes on top of that. So without all those steps, like if I just put a filling on a tooth and hardened it, it would pop right off.
Oh, it wouldn't stick. So it
It
kind
wouldn't
of gives
stick.
it like a rough surface to bond on.
That's exactly it. So by opening up those tubules, you're creating this bonding area for that filling to actually hold on to. For
Perfect. Thank you.
example,
Makes
if
sense.
a patient comes in and I'm checking their shade, what shade their teeth are, and I'm going to do some cosmetic bonding on the front, I will literally just place the filling material on their front tooth and then cure it with the light and check the shade, knowing that I can pop it right off because I did not do the etch or the bonding.
Oh
So
wow.
it's actually a great way because once you cure that composite, it can change its shade just slightly. So that's a way I just check it to make sure we're going to like the end result. And then I pop it off, and then we actually do the work on the tooth and etch, bond, and fill at that point.
That's super unique. I've actually never seen a dentist do that.
Oh, really?
That's a
Yeah.
cool way of going about it too.
And it's super fast. And then the patient can look at it too and make sure that they like that shade as well.
Hmm. But now also like dental technology even allows the patient to see what the after result is before even going about the treatment.
That is true. We have not instituted that in our office, but it looks phenomenal.
100%.
Yeah.
So I actually, as a follow-up question to the whole etch thing, I know like certain like some dentists use like total etch versus self etch. Can you describe like the difference or your own experience with it or anything about it?
Sure. So I use the total etch technique, meaning etch and then bonding agent, and then the filling material. I use those three steps when I'm concerned about retention and I want to get the best hold that I possibly can, but I'm also not concerned about sensitivity. Sometimes the etch, because it opens up those tubules, can cause some post-op sensitivity after a filling. Um, and so that's where uh, there's times I might leave that step out if I'm concerned about sensitivity. Does that help?
Yeah, 100%. I know I've usually seen like actually I think I've only seen one dentist use self etch. Otherwise, usually I think the classic way to go is just total etch.
That's exactly what you'll learn in dental school because you can't go wrong with it.
100%, 100%.
Yeah.
So a couple more questions we got. I
Sure.
could ask you at least is if you could change anything about the practice of dentistry, what would it be?
Hmm. That is interesting. I'm not sure if I have one that comes to mind.
Hmm.
As a female, it has allowed me to have a work-home balance, which I think is unique. I have a lot of friends that are lawyers and physicians and what have you, and they are very disillusioned with their profession. I've had a number of uh, uh, parents growing up that were physicians and told their children to not go into the medical field or not go into law or not to do whatever. But as a dentist, I see so many parents who are dentists that told their children to go into dentistry. So there's just a whole different feel in dentistry that one it makes you proud to be a dentist. So I'm sure we have our faults, but in general, I would say it's a wonderful profession made up of wonderful people. And it personally, for me, I only practice 3 days a week. So I'm able to be home we've got 3 young children. So that just provides a balance in life that I have not seen in any other vocation.
I actually have a question. So like, I'm sure you have a lot of hectic days over there at the office. Are there any like, hobbies or any ways that you try to tone down your stress like after a long day of work?
Yeah, so these last few months have actually been quite stressful. So it's a good question. I love to run. I'm a runner, so always that's always been my go-to to get out stress. And so as I mentioned, we have 3 young kids. So by the time they're in bed, it's usually 7:30 or 8, so it's not that late. My husband also loves to run, so we just take turns who gets to run while the other one stays home in case the kids need us. And then we just switch. And that personally has been a de-stressor for me as we're navigating a lot of changes in our office where we are incorporating new software. We're also like having patients check in on iPads where they fill out their forms on an iPad instead of paper. We also send them all the paperwork ahead of time. But so all these new changes have brought about some stress as well. It's all for the better. But that I have found that running every night has been a de-stressor for me.
Oh yeah, exercise is extremely important, especially as a dentist when your neck is basically face down
Yes.
24/7.
I would say also they should put weightlifting in dental schools as a class requirement because it is hard on your body. So I do a lot of yoga. I try and lift weights as much as I can because people probably don't understand this, but you do and you will. Dentistry is like a full physical job. So your back, your neck, everything is involved. So you got to keep everything healthy.
100%.
Mm-hmm.
Now,
Ibrahim.
for our final question, so I know you mentioned in the beginning about all the professions like you wanted to do, even since you're like you're really little, right? So if you're not practicing dentistry, what do you think you would be doing?
So I still want to be an archaeologist, as strange as that is. I still want to go on a dig one day. So I think there's that just hidden desire still. So I guess I haven't grown up too much.
That's good to hear. You still got your passions.
That's right.
For sure, for sure. Thank you so much, Dr. Hoover. That was an extremely informative session. And I want to thank all our viewers for tuning in and asking questions. And if you guys have any other questions, you guys can hit up Dr. Hoover's Instagram. It can be found on our Dental Shadowers Instagram page. And on that note, if you guys are looking for our quiz, that can also be found on our Linktree or our GroupMe. But on that note, I want to thank everyone for joining, Dr. Hoover. Thank you so much. And I hope you all have a great rest of your day.
Thank you.